All right, here we are. Happy Friday, everyone. This is MedAffairs Talk, and today we are not talking about medical affairs, or only partially talking about medical affairs. We're actually going a bit broader than medical affairs itself. As you may know, if you follow MedAffairs Talk, we tend to obviously cover a variety of different topics, usually fairly specific to medical affairs and in general around innovation in medical affairs. But we tend to sometimes go a little broader and also speak about what's happening at the intersection between medical affairs itself and maybe other functions or other players in pharma or more broadly in the healthcare ecosystem. And I think that today that's exactly that particular case. We're really going to be speaking to the interface between medical affairs and market access. We have an expert with us, which is always good because I don't think I know much about market access, or not enough, definitely, for this particular presentation. So it's good to have you, Francesca. We'll give you the chance to introduce yourself in a minute, but before doing that, Marika, do you want to say a few words?
Thank you, Luca. Yeah, like you, I'm very much looking forward to today. I'm pretty sure I'm going to learn a lot because I don't know anything about market access either. But I'm very interested in hearing both of your views on, how eventually collaboration can help and benefit patients and patient outcomes, because that's really, what drives me at least, and I hope it would drive others too. So the collaboration in this ecosystem, hearing from the two of you, will be very interesting. So with that, I want to hand it over to you, Francesco, and welcome for being here.
Well, thank you so much. No pressure at all, I should say, right? So, first of all, I want to thank you guys, Marika and Luca, for having me today. I want to say hi to everyone in the audience that are joining us today. It's an honor for me to be here and sharing my thoughts and perspectives. My name is Francesco de Solda. I'm currently working at Johnson and Johnson as a global market access leader in oncology. I'm a pharmacist by background and MBA by passion, I would say. I've been around in the pharmaceutical industry for 15 years right now. I spent my first half of the career mainly focused in R&D and clinical development in oncology. And the second half of my career still is, mainly focused in market access, healthcare, HEOR, and so yeah, here I am. Before joining J&J, I spent almost 7 years at Bristol Myers Squibb. So my career, as you can tell, ranges in between different functions and geographies as well. And since 2017, I'm based in New Jersey. So that's kind of a little bit of myself. And if I can, before to share my thoughts, and of course your questions are more than welcome, let me say that everything I'll be sharing with you guys today is based on my personal experience and is not reflecting, my employer's position.
Very good reminder. Very good reminder. That's very important.
Great, great. And while you mention it too, we have the chat. So anybody who's watching at the moment, you can just enter by making a comment on the post, whether it's Twitter, YouTube, Facebook, wherever you are. So you can engage with us in the conversation. And so my first question, because I have absolutely no idea about market access, I think you're that fancy bird that's sitting, somewhere out of my peripheral. I'd love to, can you tell me a little bit more about what the foundations of market access are?
Absolutely. Happy to. And I must say that, like I said, I spent a few years in the R&D space, and at that time I didn't have a clue of what market access was. So I think it's a common question in the industry. But what I experience is that sometimes people think they know what market access is because they link market access with pricing negotiation, at the very end of a very long process, as you know, right? But it's not just pricing negotiation. The market access. So the brief definition that I would share with you, and again, it's my personal definition of market access. Someone else could have a different opinion. But rather than defining market access as a function or an organization, I would define market access as a functional expertise that as let's say the main objective to assess and communicate the value of health technologies. And in my case, I work with medicine, so drugs, with a very broader objective. And that objective is to promote and facilitate decision making with the ultimate goal of enhancing the quality of healthcare systems and make those healthcare systems accessible to everybody, efficient and equitable. So it might sound a little bit complicated, but this is the way I would define market access. And if I may add something, organizationally speaking, now going to focus, looking at our day-to-day activities, market access as an organization is made by a multidisciplinary subject matter experts. So we have generalists that look at the strategy of the market access and its execution, like myself. But we have also very specific subject matter experts that, for example, data science or health economists, epidemiologists. So most of us, particularly in the last, I would say, decade, as a professionals in the market access, have very solid scientific background in education.
That's really, really helpful. Thank you. I think even me, I was able to kind of follow and understand what market access is. So I think you made the impossible possible. That's good. I guess one of the words that you have already used a few times, and I think it's what I usually think of when I think of market access, is value, right? So you guys are really the team that look into value for new treatments, for new medicines for patients. And I know there is a lot that goes into that. I'm sure there is a big chunk of your work that goes into defining that value. So do you want to maybe speak a bit more and double click a little bit into, first of all, what is value, and how do you go about defining value for new medicines?
Thanks, Luca, for the question. It's hard to say in very few words what value
Take your
is.
time. Take your time.
And I'm Italian, so I have the tendency to talk a lot, and I don't want to bother you guys. So let's start from our day-to-day life, right? So if I ask you, what do you think value is, might be, you might give me a different definition,
Right.
different perspective. So it's something in our day-to-day life. It's something for sure subjective, right? Most of us have the tendency to make a clear link between value and price. And sometimes this is not accurate. So we have the tendency to think that something that has a price of 10 has a value of 10, right? So the price is, commonly speaking, is a measure of value. But that's not like appropriate, particularly in general, but particularly in the healthcare system. So value cannot be defined just with one dimension. It's for sure something multi-dimensional that takes into account different variables, and it should be defined under a pre-specified perspective. So it should be Francesco's perspective, Marike's one, Luca's one, etc. Of course, I'm making this up. The perspectives in the healthcare system come from, for example, the payers, the decision makers, the payers, the prescribers, the patients, and so on and so forth. So it's important to define the perspective on how we want to define value. Once we agree on the perspective, then we can narrow down and identify the multi-dimensions, as I said. And so we can talk about clinical value, we can talk about humanistic value, we can talk about economic value. These are at least the three more common dimensions of the value, but there are more. For example, environmental value or ethical value. So it can be, really broaden up as needed, depending on the case. But in a nutshell, the way I would define value is through the three key dimensions that I mentioned. Clinical value, humanistic value, and economic value. And each of those dimensions can be, of course, double-clicked and expanded. And then we can talk about specific drivers in each of the dimensions. That might be clinical endpoints, it might be quality of life, safety, it might be for the economic value, might be costs or healthcare resources utilization, and so on and so forth.
Great. So actually, can I ask another question to follow up on that? Because you mentioned those three pillars, and this sounds like a perfect, a way where medical affairs and market access can actually collaborate. Because there seem, so you say economic, clinical, and humanistic or patient outcomes, or patient, how do you call these things again? The patient's reported outcomes?
Humanistic.
Right. Okay.
Patient reported outcome and quality of life.
Right. So those seem like really important, areas where both medical affairs and market access can really integrate. So I'd love to hear from both of you actually how the collaboration can exist and how we can all facilitate in getting to that collaboration. And then after, the initial thing, I have another question, if I may follow up. So Francesco, do you want to start?
Absolutely. So let's say in a perfect world, the collaboration between market access and medical affairs should happen very, very early on in this life cycle of a drug. Because remember, as you mentioned, one of those dimensions on how we are able to define the value of a drug is based on the clinical outcomes. So it's based on scientific drivers. scientific outcomes, clinical outcomes that should be defined in a very, let's say, co-creational way and aligned way, leveraging this key collaboration between the two area, the two functions. I think this is just one of the opportunities that the two functions have to collaborate together, and we can discuss even further if this is something of interest. But yeah, how to define the clinical value of a drug, that's one of the key success factor of this collaboration.
So maybe one question I have, because of course, when I think of everything you just described in terms of defining value, assessing or measuring value, but then of course there is a big component which is how do we communicate value, right? Clearly the reason why you and your team do all of this is because we want to make sure that all the appropriate stakeholders in the healthcare system are informed and aware, and appreciate the value of the medicines or the innovation we bring to patients. So can you maybe speak to maybe some of the key stakeholders we have, because again I'm pretty sure that people on the line will realize that often we actually there is a significant overlap when it comes to the individuals and organizations and stakeholders we engage with from a medical affairs standpoint, and you guys engage with from a market access standpoint. So right there you have great opportunities for partnership, synergy, collaboration. So do you mind like speaking a little bit to what's your audience? Who are the people that you engage with?
So I'm not gonna make a list by importance or by priorities, not at all. But for sure, decision makers, meaning HTA bodies, for example, in the USD FDA, for example, and other other regulatory bodies are one of our key stakeholders. Then payers, depending on how the healthcare system is built, you can have one single payer or multiple payers in a specific in a given country or in a given market, and HCPs like healthcare professionals, prescribers. In my case, as I work in oncology, as I mentioned, oncologists, uro-oncologists, nurses are my key stakeholders as well, because it's important to engage strategically with them to understand their perspective and to bring their perspectives in our world, right? So it's something that should not be minimized at all. I agree with you, Luca. There are a lot of opportunities to build those synergies and to make those interactions efficient and proficient and fruitful from both perspectives. We should not be seen as two independent functions that are pushing or pulling or trying to achieve different goals. Not at all. We have one strategy, one specific objective to achieve, and again, by leveraging this collaboration and synergies, we can absolutely achieve those objectives, collaborating with our shared stakeholders, external stakeholders. Something that is popping up on my mind as well is the active scientific collaborations that we have with oncologists, for example, in my case. So, they contribute to our data generation strategy, interpretation of the findings, and making sure that everything we do is properly done from a scientific standpoint. We develop real-world evidence protocols, for example, and having those external scientific experts that can guide us through to the scientific robustness, it's very, very important. It's crucial, and we do that thanks to the partnership that we have internally with the medical affairs colleagues.
So maybe just a quick follow-up. We probably have time for 2 more questions. So I'll ask a quick one, and then I'll let Marike maybe take us home with a final question. So obviously you have a global perspective, right? So you have a good vantage point in terms of seeing different markets, different regions, different needs, different ways of probably interpreting the role of market access. So anything you can share in terms of are there significant differences when you look at different regions, whether it's the US, Europe, Asia? Are there maybe different needs, different requirements, different things you have to think of that may be more important in certain regions or with certain payers or with certain health authorities, and maybe less relevant for others? I'm just wondering, again, if you could give us some color when it comes to the regional differences around the world.
Yes. So the world, from a market access perspective, is extremely segmented and extremely heterogeneous. So something that can be applied easily in a given market doesn't make sense at all for another country, another market. So it's extremely important to get those insights from the markets, from the local markets, the countries, through the regions, and having this, bi-directional and open dialogue with the regions and the markets in order to make sure that we'll be able to address their needs that are multiple and most of the time very different. Again, the strategic collaboration between market access and medical affairs can help in making sure that those perspectives, not only from a payer standpoint, but also from a medical affairs standpoint, can be crystallized in one aligned strategy and approach. And you can tell, Luca, right, that guidelines, the medical guidelines, are somehow different in different regions and countries. So that's another area of key collaboration, making us, from market access standpoint, aware and knowledgeable about all those changes and sometimes small nuances that are important to know.
So then I'll come with the last question, and so what is the future, the near future or the distant future, or do we have some very interesting, outrageous predictions for the next couple of years?
Wow, that's a big one, Marike.
I'd like a little exaggeration, something really out there, because if you try to, what is it? If you shoot for the moon, you at least land between the stars. So where are we going?
Yeah. So let me start with a joke and then I'll become serious. If you give me an espresso coffee, I can talk about it for hours. Mm-hmm. But again, I mean, we don't have that much time, and then I don't want to bother you. with my philosophical, future-looking theories. But what I'm comfortable to share with you is that there's no doubt that the world is changing. And what is important from a market access perspective is that there are macroeconomic dynamics and macro and micro economic dynamics, geopolitical balances that if you look at the news, you can clearly tell what I'm talking about. So at the bottom of this chain of events, the countries are suffering, and particularly I'm referring to the national healthcare systems, right? We just experienced after 2 years or more of pandemic, how much pressure was put on the healthcare systems, globally speaking, and that was a signal of something not really healthy coming from the past. So now you're asking me something related to the future. I think we should fix that. We should make sure that appropriate resources and funds will be devoted to healthcare systems and patients in general for the sake of health population. What is going to happen? I think we're going to see more and more pressure from a budget standpoint, resources standpoint, that are going to disrupt the way the healthcare system works today, and it's going to work tomorrow. And I think the pharmaceutical industry should monitor very closely those changes and make sure that we as an industry, we don't lose traction for those changes, and we should adapt very quickly to those changes. I know it's a very, if you will, broader answer. We don't have the time to go into the details, but changes are happening everywhere in the healthcare systems, and we should monitor and try to do our best to proactively interact with the payers, in this case, from an access perspective, and influence those decisions and future decisions, and try to drive the debate, as I like to say. This is something that I learned recently. Drive the debate, meaning having this proactive approach with our stakeholders.
And so if there's one thing from medical affairs that you would like to get, like one little requirement, what would that be? I know, trick question. Last question, last 2 minutes, one trick question.
Really try to embed a collaboration spirit, a co-creational co-creational processes and way of working together with the medical affairs colleagues, both from office, from the field, because that collaboration is critical for many aspects, many goals that we have in common.
So I know we are at time. There was actually a very, very good question around benefit design, but I don't think I'm gonna rush this. So maybe that's something we can take offline. But thank you, Francesco, for your time. This was really, really, really informative. I learned a lot. I think it's amazing to see how many opportunities for collaboration there are between medical and market access. It's also great to have a bit more of an appreciation, thanks to the very good insights you share today bit more of a deeper appreciation of all the great work you guys do. So thank you so much for joining us, and thank you, Marika, as usual, for your great question. And this is Medical Affairs Talks, and we are gonna see you next time. Happy Friday, everyone, and have a great weekend.
Thank you very much, Luca. Thank you, Francesco, and see you next time.
Thank you for having me. Bye-bye.
Bye.
Bye now.